Welcome, everyone. We are here for the Society of Thoracic Surgeons Congenital Heart Surgery Database monthly webinar for today, Tuesday, June 15th. Thanks, everyone, for joining. Let's see here. On the call today, we have myself from STS. We have Emily Conrad. We have Addie Dolan. We have Carol is out today, so she will not be joining us. Also, we have from our core group, we have Chastity, Janet, Leslie, Dr. Meyer is on today. And then from the Iqvia side, we have Melanie, Michelle, Joe, Anna. Let's see who else we have. Jean. I think I got everyone. Did I miss anyone from the Iqvia side? I think that's everyone. If I missed anyone, I apologize. But welcome. Thanks, everybody, for joining me today. For our agenda today, I'll just give a brief STS update. And then afterwards, I'm going to turn things over to Chastity for a review of the primary procedure determination. Then we'll switch things over to Iqvia for a quick update, and then we'll end with our user feedback. If you have any questions, please do submit those via the Q&A function. We also, I believe the raise hand function is also still enabled. So if you have any questions or need to clarify your question that was submitted via the Q&A, just please raise your hand and I can unmute you. Just again, just be sure that your microphone is enabled so we can hear you. And also, just a heads up, I just wanted to elaborate further, just so everyone is aware, the STS has hired Chastity as our congenital consultant. So Chastity is on board. Chastity will be addressing all of the FAQs. She'll be assisting us with webinars such as, our data manager education. She'll also be assisting with upgrade information. So this is a huge help to us and to me. Again, Chastity will be tackling the FAQ mailbox. Please continue, the FAQ process is the same. Submit your questions via the FAQ. Chastity will be answering questions out of that, and we'll be also, covering questions on our monthly core group calls. But this is just a huge help to me and to STS. So thank you, Chastity. We're grateful to have you on board and helping us out. So with that, let's go ahead and get started. All right, for our 2020 harvest analysis update, again, data, we are still on track. We are expected to release that 2020 analysis data this summer. The dashboards will be beta tested prior to releasing that information to you all. And STS will notify participants when that data is available within the Iqvia platform. So when that data is released, you will receive a notification from STS. The 2021 harvest update, as you're aware, the spring 2021 harvest is still underway. We have not determined a harvest close date. As you're all aware, we wanted to give participants plenty of time to review your 2020 results prior to closing that harvest close date. So we'll be setting a harvest close date after the release of that spring 2020 data to give you guys time to provide any feedback. And again, just a reminder, please do continue to use the open submission and continue to clean up that spring 2021 harvest data. And again, we are accepting that through procedures up through 12/31/2020. The 2021 congenital audit is underway. Selected sites were notified. We do have an upcoming audit deadline that I wanted to share for those sites that were selected. Just a reminder, July 1 is the upload deadline for your random case records, mortality case records, linking file. And again, any audit-related questions, please send those directly to CRS, and the CRS team will be able to assist you with any of your audit-related questions. Data version 6.22 update. Again, just a reminder that I announced this on our last call. The go live has been moved to July 1, 2022. We are just a quick recap, incorporating the adults with congenital heart disease component in the new 6.22 version. And again, that will be for patients 18 and older only. We'll be adding select variables from the adult cardiac database. We are working closely with our surgeon leaders as well as vendors to incorporate this new component into the congenital database. So just to be aware that is coming. And again, this go live date has been pushed back to July 1, 2022. Prior to go live, we will hold upgrade webinars for data manager education. These will be weekly webinars, and right now we're tentatively scheduled to begin the 1st of September, around September the 7th. We'll be conducting a walkthrough of the new data collection form. All upgrade webinars will be recorded and posted out on the STS webinar page if you are not able to attend these webinars. And again, we will be providing ample education. There will be a lot of education needed for that new adult with congenital heart disease component. So Carol will be providing all of the education for the adult component. So again, if you're unable to attend these webinars, they will be recorded and posted out on the STS website and YouTube channel for your review. Also, we will be working on a new and improved training manual. So that's one of the things the core group and STS will be taking on, is working on a new and improved, more user-friendly training manual for you all. So if you have any comments or suggestions, please feel free to send those my way. We're also looking to add surgeon worksheets for the congenital database. So those currently have surgeon worksheets for the adult cardiac database, but we're looking to provide those for this data version for congenital. And also, if anyone also participates in general thoracic, there's a new data version coming out next month for that, and we'll working to add surgeon worksheets for thoracic as well. So we definitely want to make things consistent across all of our databases. So we will be working to have those available for you as well. AQO, just a quick update. Our virtual meeting is again this year, scheduled for October 12th through the 15th. Our congenital session will be held Friday, October the 15th. As your abstracts are still being accepted, the deadline is this Friday, June 18th at 11:59 p.m. Eastern Time. So just be sure and get that abstract in. Again, the deadline for abstract submission is this Friday, June 18th at 11:59 p.m. Eastern Time. Again, we are having free registration for all data managers. Just a reminder that you must be listed as a contact data manager on your participation agreement with the STS in order to be eligible for that free registration. If you are not sure of the contacts listed for your site, please reach out to us at stsdb@sts.org, and we can work to give you a list of contacts for your site. Just to give you a little preview, the Congenital Planning Committee has met. We will be meeting again, I think, this month or next month. But just to give you a little preview of some of the things we're planning, we are planning a session on DORV, diagnoses, Norwood. We'll be including case scenarios. We do plan to have a stat category update, a presentation on the upgrade, as well as a session on how to use your data for everyday practice. So again, those are just a few, just a glimpse into a few of the sessions that we're planning. If you have any ideas for sessions that you'd like to see, please email those to me at ljones@sts.org. Again, the sooner the better. I believe we are planning to meet again either later this month or first of next month. So again, please get those suggestions to me rather quickly, so I can share with the group on our next call. Also, again, just a reminder that the STS Cardiothoracic Surgery ebook is available. If you need more information or want to learn more, just reach out to, or just go to our website, sts.org/ebook, and you can find all of the information about the STS ebook out on our website. It is a phenomenal resource. Just know that there is a fee to subscribe. So again, all of that information can be found out on our STS website at sts.org/ebook. All right, that's all that I have from my end. So next, I'm going to turn things over to Chastity for a review on summary procedure determination. Chastity?
Thank you, Leanne. Can everybody hear me?
Yes, ma'am.
I think so. Okay, good. Just making sure that I turned mute off, right? So thank you, and thank you in my official capacity as a contractor for STS and bring you this education monthly. For all of you out there, if you have any education topics or just things you would like to see discussed on these calls, I want to make this useful for all of you. So please just shoot me an email and let me know what you would like to see. And thank you to those of you who did tell me you would like to see something about coding primary procedures in a multi-procedure operation. So thank you for your feedback and for the information you gave to me, or even just the questions you asked me that helped me put these slides together. So again, keep the ideas coming so that these are useful to you and that we can all learn from one another. So the first thing I'd like to say about coding primary procedures when there are multiple procedures done during one operation is that this is not simple. It can be daunting, it can be tricky. There are a lot of rules to think about. And so I wanted to outline this in just kind of I guess, a format that maybe you can apply and use as you start going through your procedures or cases that seem to be most complex. You can't do this from memory. There's no way to memorize every rule that's out there. And let's face it, new exception rules are always going to occur and come out. And so I think the best thing to do is know your resources and know what to have open or what you can refer to when you are coding a very complex case. So the factors to consider when you're looking at an operation that had multiple procedures performed are that you do correct procedure coding, that you apply the stat scores, and that you have exception rules in front of you. And this will allow you some greater knowledge when trying to figure out what is going to be considered the primary procedure or what order of operations you should list in your database. Next slide, please. Okay, so starting with correct procedure coding. We know for a variety of reasons that we need to be able to correctly code what procedures are being done. But if you list an incorrect procedure, then perhaps the wrong procedure is going to be coded as primary. And so this becomes really important that you're accurately pulling out all of the procedures that are done by a surgeon. So the first place to start is reading the op note. Reread the op note and read it a third or a fourth time if you have to really kind of list out what the procedures are. If there's any confusion, go to your surgeon and talk to them. I never go to my surgeon and say, hey, what do you think the primary procedure is? It will always be at odds with what the exception rules and all of that. I like to say, tell me what was done during this case. Help me understand all of the procedures that were completed. I'm going to rank them using the STS rules and knowledge. But at least if they can tell me where the blood is going, I can understand what procedures were done. And then of course, refer to your training manual. So your training manual is your best resource for understanding how to code, especially some of these trickier procedures. So for example, how do you code a pink TET? Or is it a co-arc versus an arch repair? Or is it a TET or is it a PAVSD repair? So all of this is spelled out in the training manual. And obviously, if you have any questions about the diagnoses that your patients have or the procedures that were done, please submit an FAQ to the core group. We love to ponder over what you're doing out there, and we'll provide a good answer for you. So I provided the link here to the training manual, but you know that this is available on the STS site under the congenital database. Don't forget when you're looking at coding the correct procedures that there are combination codes that are required as well. So taking those into account, and you'll see those listed in the training manual, as well as, our Iqvia reports are a nice way to look at those and see if we're missing any combination procedures that should have been used. Next slide. So primarily, when you're designated your primary procedure, this is largely done by selecting the procedure with the highest stat score, which is why you want to make sure that you have all of your procedures entered correctly so that you know that the correct stat scores, that you're looking at those. Now, some of us have software that have the stat scores built in, and this is really easy to do then in your software to see what has the highest stat score. For others of us, we don't have that built into our software, as previously it's not been a requirement for vendors to list the stat score. So for that, there on the STS website under the congenital database, there is what's called Appendix C, which lists all of the stat scores currently today, which was updated last July of 2020. So as you recall, for those of you who've been doing this for a little while, that we underwent a software upgrade about 3 years ago. And in that version, there were some procedures that came out. Let's say, for example, some of the DORV related repairs that came out, but those did not have associated stat scores. Last July, it came out that those procedures now do have stat scores, and that's what was updated in this Appendix C. So now you can use those as primary procedures in your software. However, your vendors may not have updated those stat scores yet. So sometimes that can be a point of confusion. So I think it's always good to have your stat score reference open in addition to your training manual when coding these cases, so that you can see that there is actually a stat score available for perhaps a new procedure code that previously did not have a stat score. Next slide. So this is true. We're gonna assign the procedure with the highest stat score as primary, except when we're not. So there are 14 current exception rules. I think when I started doing this 10 years ago, there was 1 or 2 exception rules, and now we're up to 14. So why do we do this? We don't do this. I don't do this actually. STS doesn't do this to drive you nuts or confuse data managers at all. These are done so that we make sure that the database is analyzing the most accurate data or some of the procedures that we're intending to analyze. So for example, most VSD repairs will include some intervention on the tricuspid valve. So because of the stat score, the tricuspid valvuloplasty would actually supersede the VSD, and we would have a database full of tricuspid valvuloplasties, which is not the intent. We're really looking at, the VSD repairs that were done and how the patients do post VSD repair. So these rules really address the areas in the database where the stat score rule doesn't allow for the best analysis. So some of these exceptions, I didn't list all the definitions of them here, but some of the exceptions will tell you what should be designated as primary, and others will tell you what shouldn't be, or when shouldn't something not be primary. You can't memorize all of these or every intricate scenario of these. So I just think if you have your document open, and so again, on the STS website, there is a document that helps you, which is what I referenced to put these slides together, called Primary Procedure and Primary Diagnosis Determination. And if you use that, all of the rules are spelled out very clearly, and you can look at them there. If you have a question, again, core group is a perfect place to go to say, what's the order that these rules are applied, or I have this procedure and this procedure, which should be primary and why, and we'll do our best to explain that to you. Next slide. So this is really kind of my outline steps. There are multiple ways that you can do this. And obviously, if you have a methodology that works for you, you don't have to do it my way at all. I find this order kind of beneficial to me. So I start with listing all of the completed procedures, making sure that I've accounted for any combination procedures that need to be used. And then I rank all the procedures in order of stat score, and then I look for any procedure exceptions. Now, I think when you get maybe more comfortable or quicker at this, maybe number 2 and number 3, maybe you look for your exceptions first and then rank in order of stat score. However you do it is fine, as long as you're successful and feel good with it. So again, here's your document reference below that on the STS website, Determination of Primary Diagnosis and Primary Procedure, and it was updated at the end of 2020. Next slide. So here's an example, if we could go through this. So your op note says there was a takedown of a systemic to pulmonary shunt, a bidirectional Glenn procedure, an atrial septectomy, and a right pulmonary patch arterioplasty. So I want to start out with listing every procedure that the surgeon has done. So sometimes I have to interpret what the surgeon's done because he or she may not use the STS terminology, but I've got to fit it into the STS terminology. So I know, just going in order of how it was dictated, that there's a shunt, ligation, and takedown. There's a superior cable pulmonary anastomosis plus PA reconstruction. So recognizing that PA patch arterioplasty and the Glenn are a combination term. And then also an ASD creation. So I've just taken the op note and found the correct procedures in my procedure list in my software. Next slide. So now I want to order these same procedures by stat score. So the ASD creation has a stat mortality category of 2.5. I'm sorry, a score of 2.5, category 4. Shunt ligation takedown is 0.8 and 3. And the Glenn plus PA construction is 0.4 and 2. So that is my order just based on stat scores alone, so nothing else. Next slide. So now I'm going to start looking for exceptions. And so if you look at our ASD creation, that falls under exception rule number 9. So there are 14 exception rules, and number 9 is for ASD creation. So if ASD creation or enlargement is done concomitantly with any other procedure which have an assigned stat score, then the ASD creation or enlargement will not be designated as primary. So I know right now, even though the ASD has the highest stat score, I haven't done, my surgeon has done an ASD creation in addition to other procedures with stat scores. So my ASD is not going to be primary. So if I move down to shunt ligation and takedown, this falls under exception rule number 6. If shunt ligation and takedown is done at the same time with any other procedures that have an assigned stat score, then the shunt ligation and takedown will not be designated as primary. So much like the ASD creation, the shunt ligation and takedown cannot be primary. So now I get down to the procedure that actually has the lowest stat score, where I have my Glenn plus PA reconstruction, and this falls under exception rule number 1. If a multiple procedure operation includes any of the following procedures, which in your data collection form is in the section of procedure specific factors, exclusive of 4 VSD procedures, then that procedure will be designated as the primary procedure. So in this example, despite the fact that the ASD has the highest stat score, our Glenn plus PA reconstruction, based on exception rule number 1, will end up being the primary procedure. How you order the next two doesn't matter. I usually just do this by then going by stat score. So I would do the ASD creation and then the shunt ligation and takedown. Next slide. So a few FAQs that then come in as you're trying to do this. So what if I code the primary procedure incorrectly? What if I didn't get it right? Does this mess up my analysis? Will I be fired? So the answer is no, because Iqvia has their primary procedure report, mismatch report, that anytime you submit data to the Iqvia portal, you can look in this report and see if you have them ordered correctly. And so they'll tell you what they think should be primary versus what you have coded as primary. Also, as a second check, DCRI will go ahead and analyze the correct procedure regardless. So even if you have the wrong one listed, DCRI knows which one to take from your list based on all 14 exception rules and algorithms that they have built in to the process. So you don't have to worry about your analysis. So what if my surgeon says, but I think this procedure is primary? So that kind of goes back into DCRI will still analyze the correct procedure, regardless of what your surgeon says you need to enter as primary, if your surgeon does like to tell you that. Personally, my surgeon wants it to match the STS reports. And so I go off all of the rules provided by STS and the database. However, there are programs who locally want to use their data a little differently, and they don't want to follow all those rules. Your analysis will still be correct because DCRI is going to analyze the correct procedure, regardless of what you have said is primary. So it's okay to have that mismatch if that is what your program decides that they want to have. Or what if right now you think the Iqvia report is incorrect? There are some things that they are still ironing out. These algorithms are complex and take into a lot of factors. So they're definitely still ironing some things out. So if you think something's incorrect, you can go through the chain of submitting that to the help desk and asking about it. You can also submit it as an FAQ because perhaps we need to look at it, or that you just need some explanation as to why the Iqvia report is correct. So there are some channels for you if you think that there is an error, and that's totally appropriate. And again, I referenced the document out on the website here. And I think, is that my last slide? Yep. So again, if you have any questions, let me know. And if there are any future topics you would like to see discussed here, I'm very, very happy to bring them.
Thank you so much, Chastity. That was awesome. I appreciate it. All right, next we'll turn things over to Joe.
All right, great. Thanks, Leanne. And thank you, Chastity. Good afternoon, everybody. I am going to cover some past releases, some upcoming releases for you today, including some of those items that Chastity was mentioning in regard to updates for the primary procedure mismatch report. Starting with the two on this slide. This is an upcoming release targeted for July 2021. So STS 6325 and STS 6337. For both of these, we are looking into reports that the exception rules are not being applied properly for the primary procedure logic, and we will be making the necessary updates to bring those in line. So if you are seeing that the Rule 1 or Rule 2 are not being applied properly, those are items that we are looking into. And like I said, those are coming in July. Next slide. So these updates, I believe I mentioned these before. These are still in the TBD state. So we are looking into getting these resolved, but we don't have a release timing on them yet. Starting with 6211, the missing variable report is showing the prothrombin complex concentrate for dose 3 as missing in the report, even though the field is not active on the case form. STS 6343, we are looking to make an update to the missing variable report so that it recognizes the selection of missing for mortality status at database discharge as a missing variable, in addition to the current functionality, which only flags it as missing if you haven't selected any response. STS 6427, the on-demand version variable will be updated so that it's no longer flagged as missing on the missing variable report. And STS 6340, the 2 in brackets indication will be removed from the MT365 stat variable as it was not intended to be included there. And that should be it for me. Yep. So yeah, so our usual 2 slides. If you have sent in anything that you need an update on, feel free to follow up on those tickets. Just hit reply on that email and ask the agent you were working with if there are any updates, and they can look into that and get back to you. And if you have had an issue logged that we didn't discuss on today's webinar, please rest assured that those are still being looked into, and we will get updates to you as soon as possible.
Great. Thank you so much, Joe. Perfect. All
Thanks.
right. Let's see here. All right. For our ending slides, again, Iqvia support plan, you're all familiar with this. Again, just please do include your participant ID number when you contact Iqvia and STS. Phone number is here, as well as the STS tech support email address. Resources, again, a list of resources that are available to you out on the STS National Database webpage. Again, the STS National Database feedback form, feel free to complete that form and provide any feedback to us. And again, here you can find all of these specific resource documents out on our STS National Database webpage. Here's my contact information. If you need to reach me directly, feel free to email me at ljones@sts.org. You can reach me via phone. This is my direct line. Just a heads up, my email has been blowing up this last week or so. So please note if I haven't responded yet, I do have your email. I am working my way through them. And I am doing my best to respond within 24 hours. So again, please just know that I am working through my emails and I will respond to you as quickly as I am able to. If you have any database operational questions, please reach out to us at stsdb@sts.org. Again, if you have questions regarding your participation agreement, current contracts, contacts, you have questions regarding direct data entry, again, just reach out to us at stsdb@sts.org. If you're not sure who you need to contact, just reach out to me. I'll answer your questions if I'm able. If not, I will forward on to the appropriate persons. Again, my email and direct line. Just mark your calendars, our upcoming congenital webinars. We have 2 user group calls coming up. Our next user group call is scheduled for June 29th at 12 p.m. Central. Then we have another user group call on July 13th at 12 p.m. Central. And then our next monthly webinar is actually scheduled on my birthday, July 20th at 12 p.m. Central. I'll bring cake for everyone, just so you know. Again, mark your calendars, June 29th, July 13th for our user group calls, and our monthly webinar, July 20th at 12 p.m. Central. That is all that I have from the STS side today. I do see we have a couple of questions coming in. So again, please submit your questions via the Q&A. We'll go ahead and start tackling those. I believe the raise hand function is still enabled. I'm sorry, again, Carol's not able to be on the call today, so I'm pretty sure it is. If you need to raise your hand, just please do so and I'll unmute you. Just make sure your microphone's enabled. So let's go ahead and tackle these questions as they're coming in. Let's see, our first one from Kelly is there an analysis in the Iqvia platform that displays COVID-19 causative patients excluded from mortality analysis? Melanie, I don't know. Melanie, is there anything in there?
No, not at the moment.
Okay.
That is an enhancement that STS has raised with Iqvia. So we are looking through all of the enhancements that we will be implementing, and that is one of the items that we will be adding to the non-analyzed dashboard, where we'll be adding a filtering function to allow users to filter based on whether or not they want to see the population of patients that are COVID positive, that are not COVID positive. So we're adding filtering feature, and also that will give you the counts, the available counts for the responses for that actual temp code that's being used. So that is in the queue. It's not available at the moment, but it is something that we plan on implementing.
And another question from Jennifer, is there a deadline for when we need to re-upload our previous harvest data per year?
There's no current harvest deadline that's set at the moment. We are asking that you complete, and again, it's only on the years where you actually had made changes and you're refreshing that information. So if you made no changes, for example, in 2018, there's no need for you to re-upload 2018. Okay, so just want to also make sure that I clear that up. So as of now, if you start re-uploading, then the information will be refreshed now. Right now, there's no harvest deadline, but of course, we don't want you to wait for when harvest deadline is set and wait for the last minute. So as soon as you're able to do that action, we're asking you to do that.
Thank you, Melanie. Let's see, question from Dawn. Sorry, I jumped on late. I have resubmitted the last 4 years as requested on the recent call. Notice that on my prime proximus match report, Kawashima was chosen over DKS as primary. This contradicts the rules. If I'm understanding them correctly, is this a current update?
I'm going to have to look at the Kawashima.
Yes,
Kawashima was updated.
This is the one, Melanie, that I brought forward last week to everybody, and we agreed that it needed to be.
Oh, so it's not implemented at the moment.
Right, it's not implemented at the moment, but it was going to be.
Okay, so
but
yes.
It's just left out of one of the rules.
Say it again, Jess, sorry.
Right.
It was left out of one of the rules inadvertently. And so, yes, this was the one I sent the email and everybody agreed. And it was just inadvertently not incorporated. And so I believe that that's the fix that you guys were going to work on that.
Well, yeah, so that's not what we're listing here on this slide. So it's brand new. So we'll have a new tracking item for that request.
Oh, okay.
Right. Yeah. These were previous. So we'll have to make that update and make sure that we share that information with the group.
Yeah.
Okay.
Okay, let's see here. Oh, you're welcome, Dawn. Thanks, Chastity and Leslie, from past calls. The educational piece has been a wonderful addition to the calls. Is there a way to add the exception rules to the actual training manual so we only have to have one document open, and then it could be updated as needed, just like when new FAQs come in? We can discuss that. That would be a lot. That's a lot of information in that training manual. I do know Chastity, the core group, and I, Carol, we're looking to revamp the training manual for the next version. So we could talk about it. I don't want to, that's a good idea. We just need to talk about it and come up with the best way to present this information and not have it in multiple locations, so we can update it in one place. So that's a great suggestion, Joyce, and we'll take that back and discuss that as a group. Let's see here. There are a couple of hands raised. I think Charlene had her hand up first, so let me unmute Charlene. Charlene, did you have a question? Unmute. It looks like you're muted. I don't know if you raised your hand by mistake. Are you there? Oh, it looks like she lowered her hand. All right. Let me unmute Kelly. I think Kelly has a question. Kelly?
Hi, I just wanted to go back to the for resubmitting 4 years of data, that conversation. I did not resubmit, I submitted data with the last harvest. And my understanding is that since I've not changed any data, historical data since the last harvest, I do not need to resubmit that. Is that correct? That is
That's
correct?
correct.
Okay,
If
all
there
right.
are no changes made within your software vendor system, if you made no changes, there's no need for you to resubmit.
Okay.
But it's for those sites that have gone in and made changes within past years, and we want to make sure that those changes are being refreshed.
Okay. All right. There was quite a bit of confusion around that. So I just wanted to confirm. Thank you.
Thank you.
Yeah, there was quite a bit of, thank you, Kelly. There was quite a bit of confusion. And if anyone has questions, I know, just go back and review last week's webinar. Melanie gave a phenomenal explanation about that request and the reasoning behind that request. She explains it a whole lot. She explained it a whole lot better than I ever could. So again, if you have any questions or need further clarification, just you could go back and review Melanie's explanation. It starts actually at the 14-minute, 15-second mark. So if you want to fast forward to the 14-minute mark, that's where the explanation begins in that request. So again, you can review that webinar if you have additional questions. All right.
And just one other
Jen,
thing, just to throw it out. The items that were, and I talk about it in that previous webinar also, but the items, there are specific variables that were not getting updated. And I think a lot of what we were seeing were when changes were being made, especially around the primary procedure, where they weren't seeing the actual change update. So they made the change within their software vendor system and the change was not refreshing. So that basically was a symptom of what we saw. So what we did was reset what we call the checksum, and the checksum allows the system to basically just take in all records that come in and refresh everything. So if you made no changes, then there's no need for you to go in and re-upload. But if you did make changes, we are asking you to go in and re-upload so that we are making sure that those changes are being processed. Okay, hopefully that clears it up some more.
Right. And Jen wants to know, will that data be resubmitted to DCRI?
No, the change we've already made in regards to the DCRI data set that was completed, any changes at that point was captured and locked. This was after the fact, so after the harvest. So the changes we saw where the system was not processing those updates, I believe started in April. So the harvest close was prior to that. So everything was in the state that it should have been in, and that was sent over to DCRI. No changes. This is where we were seeing users were going in and actively changes primary procedure, and then they saw that the information wasn't updating on the report. So, and that started within the April timeframe.
Kelly, did you have a follow-up question? I saw your hand was still raised. I think you're unmuted. There you go.
No. Oh,
Okay.
Okay. Thank you.
Okay, great.
This
Oh,
is
no, thank
Dr.
you.
Meyer. Maybe I could just add one thing that, since we do a 4-year rolling harvest, right? If you had previously submitted something for 2019, say, for instance, and that was in your last harvest, but you found you got a new follow-up date on somebody, or you decided you wanted to change the primary procedure or whatever modifications to the data, that wouldn't change what is already existing at DCRI, but when DCRI runs the next harvest, it will be updated with the new data. That's the intent.
Correct. Thank you.
Thanks,
Thank you,
Dr.
Dr.
Meyer.
Meyer. All right. Not seeing any additional questions come in. No hands are raised. Let's see. Again, while we're waiting, just again, just mark your calendars. The next user group call is June 29th and July 13th. Next monthly webinar is July 20th. And again, just a reminder, we still are currently on track to have that 2020 analysis data available to you all this summer. So we're still on track. We're looking at tracking sometime next month. I don't have a specific date yet, but we are working very hard. We're working with Iqvia we're working to establish our STS UAT date. So we are getting very close, and Iqvia is getting finishing up the dashboards and getting that data readily available for you all. So we're excited about that. I don't have any additional questions at this time. So with that, I think we could actually make this a little bit of a shorter call this time. Again, anyone, if you have any questions after the webinar, or if you're not clear on anything, please feel free to reach out to me directly. Again, my email is ljones@sts.org, or you can feel free to call me at my direct line. Again, just know that my emails are kind of blowing up this week and last week, so I am working my way through those. So I promise I will get back to you. Okay, I'm still not seeing any additional questions, so I just wanted to thank everyone for joining today. Chastity, thank you for that education. That was amazing. We look forward to you providing additional education for us on our next monthly webinar. Again, anyone, if you have suggestions for topics, please feel free to you can either email those to myself and I can forward along to Chastity, or you can email Chastity directly. So with that, thank you everyone for joining today. Melanie, Iqvia team, Dr. Meyer, core group members, STS team, thank you guys very much. I appreciate it. I hope you guys all have a great rest of the week, and we'll see you on the next user group call. Thank you, everyone.